Hello, everyone. My name is Shakita Christian, and this is Nursing 456 Senior Practicum. And today I did my PowerPoint on an in-service that I provided for my staff members on infection control for patients receiving in-center hemodialysis. Infection control is a very important role in the medical field. Proper hand washing and knowing when hand sanitizer is okay to use is key to decreasing the spread of bacteria. In hemodialysis patients, they are immunocompromised, and that makes them more susceptible to infection. Vascular access is the source of 70% of bloodstream infections, and patients on hemodialysis is susceptible to both viral and bacterial infections. So my practicum goal was to design, implement, and evaluate a general infection control and service training program for nursing staff on care of patients receiving in-center hemodialysis. This in-service is done for continuous education for patients as well as the staff. Evaluating the staff following the proper policy and procedure will help decrease the percentage of preventable infection control. The strategies for this in-service would be to locate, read, and analyze the current policy for infection control. By doing this, I looked over the policy to obtain information on when to wash your hands and when hand sanitizer can be used. I provided the staff with an in-service on how to prevent infections by hand washing, and I made sure that the in-service was interactive to keep the staff's attention. Make sure all staff attend the in-service. By doing this, I provided a roster so all participants could sign, and making sure that I didn't miss anyone. And if I did or they were not there, I would see them the next day and make sure I do the in-service with them. Proper hand washing should take approximately 20 seconds. Humming the happy birthday song twice should get the job done, making sure to clean under the nails and in between each finger to clean off as much bacteria as possible. Cleaning the palms of your hands and the top of your hand, anywhere that bacteria is visible or your hands can be exposed to blood or body products. I made sure the information was obtained by providing them with a 5-question quiz regarding the in-service. Ensure that the staff are following the proper techniques. To prevent infection control. Observe the staff washing their hands when in contact with blood products, and observing the staff reminding the patients to wash their hands and access prior to treatment. By educating the patients on washing their hands and access prior to treatment will reduce the infection rate and keep patients safe from bacteria. If the patient is unable to wash their hands and access, the staff should provide the patient with hand sanitizer for their hands and properly clean their access for them. Hand sanitizer can be used after using a computer, helping patients with their belongings with gloves on, and when hands are not visibly soiled. Proper PPE on the treatment floor requires a lab jacket, mask, face shield, goggles, and gloves. PPE should be removed before leaving the treatment floor and in considered clean areas. So considered clean areas is the waiting room for the patients, the hallways, stock rooms, the break room, and when you're leaving off the treatment floor. Anytime you're leaving off the treatment floor, you have to remove your PPE because that is only for the treatment floor. Hand washing is done before entering the treatment floor when hands are visibly soiled, after touching the machine with a gloved hand, and when leaving the treatment floor. The continuous education about infection control will keep the patients and staff safe. So the access surface should be dry for at least 15 seconds prior to cleaning the access with alcohol, and then waiting an additional 15 seconds before being stuck with the needle. This will allow the skin to dry so bacteria will not enter the body once the needle punctures the skin. Less access infections will occur. And then identifying the awareness of standard precaution regarding infection control. Decrease in infection-related anxiety. These are for, the anxiety is for patients that are already been on dialysis, but especially the new patients that come in and they're unfamiliar with what's going on. Everything is new to them. So we help by decreasing their anxiety by educating them on what their day-to-day dialysis days will look like, and the importance of washing their hands and the access, and making sure that the access is fully functioning, so we can help these patients and decrease their anxiety by letting them know what needs to be done so they will not get these infections or bacterial infections by not properly washing their access and washing their hands. Continuous education for the patient, staff, and new employees will keep the infection rate to a minimum by everyone working together and reminding each other about the importance of PPE hand washing when coming in contact with blood and bodily fluids will keep the staff safe. Always remember that patients in hemodialysis is immunocompromised and they are more at risk to getting infections from us not doing our job and washing our hands. These are the resources that I looked up for articles about infection control on hemodialysis and in the medical field, period. Thank you.